It is the second week of July, which means we're getting closer and closer to back to school season. WBKO's Laura McCauley is live in studio with what parents need to know when it comes to their child's overall physical and mental wellness. Hey, Lauren.
Hey Kelly, that's right. Back to school season is upon us, and that means many families are starting to make preparations now, including getting up to date on shots, checkups, and for athletes, their annual physical. Now I spoke with Dr. Suman Shaker, who says back to school exams are super important.
Exams are done like every year from the age of 5 years.
During the wellness exams, children are checked for things such as hearing, vision, mental health, behavioral issues, and nutrition. They also help with prevention, tracking growth and development, and catching any potential illnesses.
All children should get their annual physical exam, and from the age of 5, we make sure they're up to date with their immunizations.
Many schools also require student athletes to have a sports physical on file each year. While it is not as extensive as a normal one, it does ensure that the child is safe to participate in the sport they choose.
We make sure the child does not have any lung issues, like say underlying asthma, which is not diagnosed, or sudden cardiac deaths in the family, which we are not aware of, or there is a murmur which we have not heard it during the physical exam.
As far as getting an updated COVID or flu shot, Dr. Shaker says there are no new recommendations for COVID, but the updated flu shot should be available sometime in September or October.
Based upon the flu strain, they would have delineated the strain in January and February, and they'll come up with the strains which can cause flu this year.
As for mental health, she says that is something they start to screen for from a very young age.
We start screening for autism from the age of 18 months, and we start screening for ADHD from the age of 5 years.
Dr. Shaker adds that as the child reaches age 11, they start screening formally for things like depression, anxiety, and talk through any issues that might be going on at school.
For teenagers, we usually we have a one-to-one talk about say substance abuse disorder, alcohol, smoking, and sexually transmitted diseases.
In addition, Dr. Shaker also recommends parents start making appointments for their child now through August so they can get in early and have all the forms needed for school done in time. In studio, Laura McCauley, WBKO News.